focus of the Physical Activity for Health Research Centre is really to drive excellent research, teaching and impact at local, national and regional level. Why that is important is because at the moment the majority of the population are physically inactive. They're not doing sufficient amounts of physical activity to protect their current health and prevent ill health going forward. So this is a global pandemic. It's a challenge that requires global effort, but in actual fact it's a local issue for Ireland at country level, at town, at village level.
A real important goal of ours is impact, building on the research impact goal of the wider university. We're keen in the Physical Activity for Health Research Centre to ensure that what we're doing can have positive and sustainable impact on the ground. But that's, for me, ultimately the goal of what research should be, and that there is real impact to what we do and that it's actually making a meaningful difference in the areas that we're researching in.
What we have to do is understand how to measure physical activity, how to influence and build interventions to promote physical activity, how to change policy that enables those interventions to take place, and how we look at our built environment and how, where we put what footpaths or cycling lanes, where we build our houses, where we build our swimming pools, our residential areas, and how all of that influences our choices to become more active or less active. And an example of one of our projects is the ul.ie project. And here we provide structured exercise opportunities where individuals from the local community come for twice a week for about an hour at a time, and during that time take part in exercise, learn about how to self-management of their clinical condition, and build a social network around how to ensure that they achieve optimal health going forward.
It has improved me immensely, my well-being, my mental state, my physical state. At this stage, I couldn't live without it.
My exercise at home would be simply doing a walk. Go with my wife walking or whatever, go myself walking, and that's all I do. It's the social aspect as well as all the exercise you do. I feel great. I leave the place buzzing and looking forward to coming back.
So the Research Centre is having a huge impact on society, and we've seen that in their work in developing our new physical activity guidelines. Every move counts. They are now developed. They are national physical activity and sedentary behaviour guidelines in Ireland, and we see their impact across a number of other projects that they're involved in with us in HSE and in HEAL.
The link with the Physical Activity for Health Research Project is central to our work. And we're very fortunate in Limerick to have such a worthy organisation that's able to work in collaboration with us on particular projects. The day-to-day work really is about informing, educating and enabling. And then the research evidence for us then gives us that knowledge to work with specific target groups.
The Physical Activity for Health Research Centre is a centre that very much is at the leading edge of research in the area of health and physical activity. I'm in the early stages of a collaboration with colleagues in the School of Engineering around how we can address school uniform as a potential barrier to physical activity participation. Maybe addressing that specifically and seeing if by changing the uniform design we can incorporate more activity, more movement before, during and after the school day.
Where we would like to see the Research Centre going in the next decade or 2 decades even is building our core capacity, building our research excellence, building our international renown and reputation as the place to go. The Physical Activity for Health Research Centre has been operational now for just under 5 years. So the future is bright. We are really only getting started.